So welcome to today's UEFA medical webinar. Last month we talked about how to get your tools in order if someone comes in with a fancy new tool, and how do you make decisions on that. Today we're taking a bit of a different approach. Today we're going to talk about how to protect your players from accidental doping. And that's, of course, a very pertinent topic. Not everybody's favorite, maybe, but one that's very, very important to talk about. Before we give the floor or the screen to our speakers, I briefly introduce Zoran Bakhtiarovic, the Chief Medical Officer of UEFA, to say a few words to us today.
Good evening to everybody. Just briefly wanted to tell you something from my 30 years experience in sports medicine as a team doctor, and then 15 years experience as a doping control officer for UEFA. The following topics that we are going to listen today are extremely important. I have been involved in few cases of the adverse analytical findings and in the follow-up of this, and I can tell you they had one thing in common: they could have been prevented. They are all preventable. Many of the things that we as doctors are doing sometimes can lead to problems or not doing can lead to the problem to our athletes. So I just want to say to you, I watched Becky present this presentation a few times. It's extremely interesting, very important, and keep your eyes and ears open. Thank you.
Thank you, Zoran. So as usual, you can post your questions and your comments in the chat. And then we'll put them into the discussion. What we normally do is a brief presentation and then a discussion section. Today is going to be a little bit different. We're going to have a brief bit of information presented by Rebecca Lee, and then follow that up with a brief discussion on how to protect your player. So without further ado, I will invite Becky and Zdravko to the stage. Hi, Becky and Zdravko.
Hi.
Maybe you both can introduce yourself briefly to the audience today. Becky, go first.
Hi, I'm Rebecca Lee, or Becky, as everybody calls me. I'm the anti-doping manager at UEFA. I've been at UEFA for almost 11 years now, and I'm really pleased to speak to you today.
Thank you, Becky. Welcome. Thank you for your time. Zdravko?
Good evening, everyone. My name is Dr. Zdravko Taralov. I'm a sports medicine specialist working in the Medical University of Plovdiv. I'm also a doping control officer for 6 years, so almost 6 years already. And for the last few years, I'm also team doctor of the Bulgarian national team, and I'm doing my best in the work in the area of anti-doping.
Wonderful. Glad to have you too, and probably some practical pearls you can share with us in a bit. So we're going to say goodbye to you for a few minutes, Zdravko, while I'll give the floor to Becky. So if all is well, these are your slides, Becky. I'm gone for a few minutes, and it's all yours.
That's great. Thank you, Eva. So thank you all for attending this webinar. Both Zdravko and I really appreciate the opportunity to speak to you today. As you'll see a bit, the anti-doping system, it's really complicated. And one of our key tasks as an anti-doping unit is to support our players and their support staff to understand the anti-doping rules and also how to protect themselves. Doctors, medical support staff, physios are key influencers on football players in relation to their attitudes towards doping. But even more than that, they've got a key role in protecting players from the risks of unintentional doping. And this is where we're going to focus our time today, which is helping you to help them. We at the anti-doping unit at UEFA, we aren't naive. We do know that there will always be players who try and cheat, but we also know that most players want to compete clean. And most UEFA cases are a result of players not asking for help, not taking responsibilities for their actions, and also, unfortunately, team doctor mistakes as well. So most of our cases, as Zora mentioned before, are preventable cases. They're not people cheating, they're people making mistakes. And the risk to the players, if they don't take responsibility, can be huge. We've got some cases that are found on the internet recently, the sanctions are really tough. The players can get up to a 4-year ban for a first offence. And it's not just damage that's done to the player's career if they get caught for doping, but also their reputation, their mental health, and also their overall sense of who they are as a footballer that can be at risk. So it's really important that we support the players to avoid getting caught up in this kind of system. So what are we going to do today to help? So as Everett mentioned, I'm going to highlight some of the rules and the doping risks, which you can see here highlighted on the screen. And then Zdravko and I are hopefully going to give you some practical tips on how to help your players to navigate the risks. Everett is going to chip in throughout the presentation with some questions, but please feel free to put your questions in the chat as well. We'd like it to be an interactive session as well, so please don't be shy and ask us anything as we go along. So let's start with the basics. I've given you the overview, now it's the basics, the rules. The rules are set by, as I hope you all know, by the World Anti-Doping Agency, which is known as WADA. And the rules are the same for all sports and all countries. So we at UEFA are simply implementing the rules that are set by WADA. And there are 11 anti-doping rule violations, which range from trafficking of prohibited substances, whereabouts failures, refusal of a test associated with a known doper. But today we're going to focus on, let's say, the most common rule violations, which is the use of a prohibited substance. And this is where we get most of our cases. The prohibited substances. I hope you all know what the prohibited list is and also where to find it. But if not, it is published on both WADA and UEFA's website. And crucially, it's updated every year. And on the list, there are certain groups of substances that are prohibited at all times, and also those that are only prohibited in competition. What does in competition mean? It starts at 11:59 the night before a match, and it finishes after any doping control related to that match. So basically, in competition means on match day. So a player would only test positive for stimulants, narcotics, cannabinoids, glucocorticoids for these substances if they are tested on match day. I'm not going to go into all of the rules because that would be a whole different webinar. But the key one that I need to highlight is the principle of strict liability. And strict liability means that the players are always responsible for any bad substance that's found in their system, regardless of how it got there and whether there was any intention to cheat or not. And that's really why we're here today, because in anti-doping, you are, let's say, guilty until proven innocent. And so we need to do all that we can to stop the players from making the stupid mistakes in the first place, to stop them from getting caught up in the system. And although it is the player's responsibility for what substances are found in their system, in reality, as I'm sure you all know, a lot of the anti-doping responsibility is passed by the players and the clubs to their team doctors. And this isn't like overly surprising, because given a doctor's knowledge and their role within the team, but players pass from club to club and doctor to doctor. And there's always a risk that your players might come across somebody who makes a mistake that could have serious consequences from their career. So we need somehow, I know it's difficult, but we somehow need to get players engaging with the anti-doping system, engaging with the anti-doping rules, and taking some of the responsibility on themselves and not just automatically passing everything to the team doctor. So I've gone through very, very, very quickly a whistle-stop tour of the rules. And now we move on to our first doping risk, which is the use of medications. There are quite a number of commonly used medications that are on the prohibited list. So clearly what I've got on the screen here is not an exhaustive list of all the medications that are on the prohibited list. But the reason I've got this up here is it's useful to flag that it's not just steroids and EPO and growth hormones that are prohibited. And I'm sure as doctors, you do know this, but your players need to know as well that if they've got diabetes, if they've got asthma, if they're going through fertility treatment, potentially there is a substance that they're taking that is also on the prohibited list. So it's just making sure that it's not just you that's aware, but that your players are aware as well. I'm going to kind of dot through the presentation a few cases that we've had recently in the last few years at UEFA, just to highlight that it does happen, and it does happen in football and at UEFA as well. So this is a case from a few years ago, and there were 2 players who were tested out of competition shortly after returning from their national team, and they tested positive for acetazolamide. And when we dug into the case, we spoke to the players about it. The tablet was distributed to all the players of the national team by the physiotherapist, and it was supposed to prevent altitude sickness. And what the physiotherapist didn't check or wasn't aware of is that the tablet was Diamox, which contained acetazolamide, and the players got a 3-month period of ineligibility. So yeah, so the risk of medication, it's real and it's there, and this is where hopefully we're going to bring Zdravko in so he can give us some tips into how to help the players.
Thank you, Becky, for this first little part. Zdravko, got you back as well. Having heard this, there's a lot of team doctors online. For you as a team doctor, what is most important to know about this prohibited list?
Well, on my experience, one of the most important things for the players is to know about strict liability, because I think that many players are not really familiar that they are responsible for what they are taking, and even after so many educations, some of them still can't believe that they can be punished for taking something that is given by their team doctor. So this is the first thing, when we always encourage the players to ask what is given to them. Another thing to know about the prohibited list is, of course, it's not possible to memorize and to learn all the medications and substances that are in prohibited list, but it's very important to be familiar with the different group of medications and to know where you can face prohibited substances, because when you are aware, you can always check in some medical checker or with the NADO if there are prohibited substances that can hide the risk for the players, like some flu medications or corticosteroids. And maybe another very important thing is that the list is updated every year. So maybe there is a medication that you use to work with years, and it's okay, but it can be included in the next prohibited list, and you should be always aware of that.
Thanks, and maybe back to Becky then. If there is this list, how can we easily check if a medication or anything contains a prohibited substance? Is there any easy tools to use for that for players and coaches?
Yeah, I was going to say that the chances of a player reading and understanding the whole prohibited list, it's complicated for the doctors, it's complicated for the scientists. So, but there are tools out there. So UEFA doesn't have a specific tool because obviously we're pan-European. So to have every medication from every country, it just wouldn't be feasible. But there are NADOs who have medication checkers, and it's actually not that complicated to double check. And there is also if your NADO doesn't have one, there is a website called Global DRO, which is Global Drug Reference Online, and it works perfectly for certain countries. So if you're Switzerland, if you're UK, it works perfectly. You can put in any medication that you're taking in those countries, but it also does work in any other country as well. But all you have to be careful of is you don't put the brand name of the medication, you put the actual name of the medication in there. And that's something that can be done by non-experts. It's really not that complicated. So we do recommend that, if possible, team doctors sit down with the players and show them how to do it, because it is feasible.
And Zdravko, you've probably heard about these tools. Do you use them in that sense, and how do players perceive that?
Yeah, of course. I use the Global DRO on my PC, but they also have a mobile application which is MediCheck, so you can install it on your phone and you have always in your hand. You can use it. Of course, some medications or some substances, sometimes maybe you won't find information for them, and then I always contact with the NADO. They're very cooperative and they always help me.
That's good to hear. Becky, last question to you before we move to the next little bit. Is there any other advice that we haven't given yet on this case or on this specific part that you want to give to medical staff?
Yeah, there's one which it's quite a big one. So I think make sure that the players are ready to challenge authority. So obviously you're giving the medication, you have checked, you know what you're doing, but I would strongly advise you to ask them to challenge you, because if they do that as standard and they ask you, could I just double check before you give this to me? Is this prohibited? And then you show them, you show them on global DRO, you say, no, not prohibited, all good, you can take it. Because if they do that as standard with you, then when they go to any other doctor, they go to a different club, they just would get used to doing it. So if you could encourage them, that would be amazing.
Are you saying they will shop until they get a positive or a negative answer?
Potentially, you never know.
Okay, you never know. Thank you for this little part, Zdravko. We're going to say goodbye to you for a few minutes again, and I'll give the screen back to Becky. There you go, and see you again in a few minutes.
Thank you. So we move to the second risk, and the one which causes a significant portion of our cases at UEFA. And this is the use of nutritional supplements. And the reason for this is that manufacture of nutritional supplements isn't regulated in the way that medications are. And there's no legal requirement for supplement manufacturers to provide evidence of product safety or efficacy. And there's no need to request approval from regulatory bodies as well before they market supplements. And this means that the contents can vary from batch to batch, and they may either intentionally or unintentionally contain a banned substance. And nutritional supplements, because it's not regulated, they can also be mislabeled or not properly describe all the ingredients on the labels. And there was a recent study in the Netherlands where it's found that a total of 25 out of 66 products that they tested contained undeclared doping substances, so not even stuff that was on the labels. And usually the ingredients that is not displayed in the label is the one that would get the player banned. And the reason that it's such a high risk in football is that the prevalence of usage is really high. Maybe if you could go to the next slide, Everett. Just got some stats here. Yeah. So there was a study that was done at a recent elite women's tournament, and 82% of players reported that they used at least one nutritional supplement in the last 12 months. So it's high. People, I'm sure you all know, people are using the nutritional supplements. And the reason it's such a risk is that the risk of them containing a banned substance is really high. And there was a literature review done of all the recent analytical studies, and it showed that between 14 and 50% of all supplements tested contain a banned substance that would get a player banned for doping. So it's a valid risk, and it's one that often players aren't really aware of when they're just taking whatever they're given in terms of nutritional supplements. So it's something that really we wanted to flag today as one of the biggest risks. And we have a case which was, I think, about 2 years ago, and it was a player who was tested in competition following a UEFA Conference League match. So yeah, it must be recent because it's a Conference League case. And he tested positive for methylhexanamine. The reason he tested positive was that he wasn't feeling well and bought a supplement called Storm from a supplement shop to boost his energy. And the player claimed to have cross-checked the label against the prohibited list, but unfortunately, what was on the list wasn't actually what was in the product, and he tested positive and got a 2-year sanction for this. So I think now it's the next step of bringing Zdravko back in.
And there's Zdravko back. That was short and concise, but a really big issue. I can see that, because you can buy nutritional supplements on every corner of every street almost. So it's really important to check that. But Zdravko, when we go to football. What do you think about nutritional supplements, and do you advise players to take them?
Well, as I always say to my players, or in general athletes that I work with, nutritional supplements are just supplemental to the proper nutrition. So we are always focused on the proper nutrition. Additionally, very few supplements have actually evidence-based benefits on performance and recovery. However, of course, some athletes they need and they use supplements, especially if they have a nutritional deficit. But we always advise them to use trusted brands. It is best if they are tested from companies like Inform Sport or included in the Kion list. And I'm extremely scared and aware of supplements, local supplements that are brand new with a very aggressive advertisement that promising magic effects and stuff like that, because if there is an effect that is so significant, most probably they can be contaminated.
And following up on this, what is the biggest risk for you as a team doctor when we talk about nutritional supplements?
Well, of course, the biggest risk as a team doctor is the risk of contamination. So that's why we advise our players to always check the medication in advance and always to share with us or with expert nutritionist or another sports medicine doctor what are they planning to take and what they are about to take, because that can be contaminated or has a risk for their career. And of course, when they decide to take supplement, we advise them to keep the package of the supplement, or to at least to take a picture of the supplement in a case of a doping control. And of course, the best case scenario, if they can keep one unsealed pack of the supplement, but that's actually not always applicable. And another thing is that we advise them to report all the supplements they have taken when they have a doping control on the doping control form, even if it's something that looks harmless like magnesium, because in the case of adverse analytical finding, that can be very useful.
Sounds like a lot of meticulous steps to take in a potential minefield. Becky, is there any advice you can give to doctors on how to manage this risk of nutritional supplements, in addition to what Zdravko just said?
Yeah, I think Zdravko hit most of the key points. So thank you for that, Zdravko. But I think it's a risk for players because often the clubs just provide the supplements to the players, and I think for the players usually that is the safest way, as long as the person within the club is trained, they know exactly what they're doing. Usually the risks for us, when they get positives, it's normally when they've done something on their own, where they've got advice from somebody at the gym or from Instagram, or just done something really they shouldn't have done, or it's getting supplements from like quack doctors, not real doctors who know what they're doing. So I think the main thing is really pushing to your players, only take something that has been checked by them, but then also it's getting the advice from the people who know, the nutritionists and the team doctors, rather than getting advice from their agent or from somebody who really doesn't have the expertise in this.
Got it. That's a clear message. Thank you again for this section. Zdravko, we're going to say goodbye to you again for a few minutes, and I'll give the screen back to Becky. And here you go, Becky.
Thank you. So I'm going to speak briefly about contamination. And contamination really is one of the hot topics at the moment in anti-doping. The Chinese swimmers, Yannick Sinner, it is all over the news of contamination, people testing positive via contamination. And the reason that contamination is more and more of a risk is that there's been a significant improvement in the lab's abilities to detect substances. And please don't quote me on this, but a recent quote that I heard was that the labs now have the ability to detect a drop of oil in a swimming pool. So they're almost getting too good at their jobs. And WADA on their side have recognized that contamination is an issue. And they have included minimum reporting levels for certain diuretics that are known contaminants of pharmaceutical products. So even potentially ibuprofen or common medications have been found to be contaminated with diuretics. There are many potential sources of contamination, and the potential sources that I've highlighted here are food and drink. So this could be contaminated meat, for example. In certain countries of the world, growth hormones and steroids like clenbuterol are given to cattle, which then boosts their muscle mass, but then that can pass potentially into the person that eats that meat. Or weight loss teas. We had a recent case with a weight loss tea, which was contaminated with silbutramine, and cocoa teas even. So there's cases that have been reported for people who've tested positive for cocaine after drinking cocoa teas. So food and drink is a source of contamination. Drug contamination, as I mentioned, there's certain diuretics that have been found to have contaminated pharmaceutical products. And then also intimate contact. So seminal fluid, saliva, skin, which is the Yannick Sinner case recently. And I think with contamination, you cannot remove all of the risks. You have to live, but there's certain things that we hopefully maybe flag that might reduce some of the risks for you. And we have a case that was recent, as I mentioned. So it's a player that was tested in competition following a Europa Conference League match, and he tested positive for the diuretic clortalidone. And the player on this side, the panel was convinced that he unknowingly and accidentally ingested clortalidone via a contaminated product. And he got an 8-month period of ineligibility. So even though it's a contaminated product, he still got a period of ineligibility for not checking everything. So whistle stop tour of contamination, and I bring Evert back in.
Yeah, we're back. Sorry, I was looking for the button. Becky, this is like you said, a really hot topic and potentially a huge problem in sports. But how much of a problem will this be, or can this be in football specifically?
I think, to be honest, every sport is concerned about contamination, and every player, and I'm sure every team doctor as well. We haven't had many cases in football. The only real case was the one mentioned, clortalidone. The others have been contaminated supplements. We haven't had any of the kind of skin contact in the same way that I remember. So it may be before me, but not in my time. But yeah, I think everybody is concerned about it, given how good the labs are at detecting the substances. But yeah, it's not particularly unique to football, but I think everybody is aware of contamination at the moment.
Zdravko, is this a problem you are concerned about, aware of? Is there anything you do to try and minimize the risks with contamination at the moment?
Well, the issue is that you can't really control all these aspects and all these risks of contamination. Of course, we are always trying to use the best hotels to control the food that we eat to be high quality food. We advise the players, if they go abroad, not to eat street food, or especially in some countries, we always advise them to use the restaurant of the hotel where we are staying, because we have our own cook, and we really rely on him.
Becky, probably Zdravko answered most of this already, but what can team doctors do to avoid risk of contamination to a certain extent, or to a manageable extent?
Yeah, so Zdravko mentioned obviously the things with food. Again, it's careful documentation of everything. So everything on the doping control form, even if the player's taken ibuprofen, paracetamol, every medication, even if that it's not something that is prohibited, put it on the doping control form. Because if your player does test positive, we can work backwards from that doping control form. One other tip would be ensure that anybody who is involved in massage of players or physios is not personally using cream that contains prohibited substances. I know that sounds really basic, but that's the Yannick Sinner case. So it's apparently it's there. That's a real risk. So it's something to flag. And I think people have got to be able to live their lives. Like, you can't spend your whole time thinking, oh my God, I'm going to test positive for something. You have to live your life. But I think the minute that somebody does test positive, we have to be able to find out where that substance has come from. So it's really keeping track of things. So food and drink, where you've eaten, for example, if you are eating somewhere that's a known risk of meat contamination, for example, keep receipts, keep track of where you've eaten, keep track of what you've done, because you would need to be able to identify the specific product. So if it's a supplement, for example, that you're saying is contaminated, you have to find that specific supplement that's contaminated. Then you would have to show that the product has been actually taken by the athletes. So that could be proof of purchase, that could be witness evidence, there could be something, but you have to be able to prove that the player's taken it. They also have to be able to prove that the substance was not discoverable through a reasonable search. And this is probably more for supplements again. But in terms of if they test positive and they say it's a contaminated supplement, for example, they have to be able to say, I Googled it, I looked on the internet, I checked, I did everything I could to make sure that it wasn't contaminated. So it's really making sure you've gone through the steps to check. You need to be able to prove that the story fits, that the product actually was contaminated. So as Zdravko said before, for example, with supplements, you would need to be able to keep the supplements. But potentially if it's a food contamination or it's meat contamination, you need to be able to show that that product actually was contaminated. And then you also need to be able to show that the pharmacokinetics work. So if a player tests positive, we would go to the lab, we would get the story in terms of the contamination, let's say. And then we would obviously go to the lab and say, does this fit? Could it potentially be meat contamination? Could it potentially be a pharmaceutical contamination? And if the lab then says, absolutely no way, the levels that they have of steroids, clostebol, whatever it is far too high to be contamination, clearly the story doesn't fit. So at that point, it's not contamination, and we're taking forward the anti-doping rule violation full against that athlete. So it's really making sure that you track back and you find the source and you follow it through. So it's keeping a track of everything that might have caused the positive test.
It's still a large responsibility there that we may.
I'm sorry.
Yeah, no, that's good. Let's get back to that at the end of the session a little bit. But for now, I'm going to say goodbye to Zdravko again for a few minutes. And I'm going to add the slides back to the screen and remove myself. Again to you, Becky.
Thank you. So management of a player's medical network is a big one. Players, as we know, they're adults and they can make their own decisions. But if you're aware that some of them are likely to make bad decisions, you as a team doctor need to do your best to prevent it, to support them. And this might mean doing what you can to manage their medical network. I'm sure you know which of your players within your team could be a liability. So what you need to do is keep a close eye on where they're getting medical treatment and advice from. One of the biggest risks is players receiving medical advice or supplements, as mentioned before, from non-experts. And this can be external fitness coaches, agents, sponsors. There's a huge number of people who get their supplements from sponsors, and they don't necessarily know the prohibited list in the way that you would do as well. Players receiving medical treatment from doctors who are unaware of the doping regulations. So clearly, you are aware as a team doctor that your players are under the anti-doping rules. But if they go and see a general practitioner, if they go to a hospital, if they travel abroad for treatment, they may receive medical treatment from someone who's not aware in the same way. And it's not just, let's say, external medical network as well. There are certain risks which we've had at UEFA where there's a lack of transfer of medical information. And this could either be internally between doctors, physios, and fitness coaches. So there is doctors that change at a club, and there's not always the information that passes in the correct way. And then, as we're UEFA, we have a lot of players that are playing at club level, but also at national team level as well. And the information needs to really pass properly between the club and the national team doctors to protect the players. So we should never be having, which I have had in the past, where a player is tested positive in competition for a glucocorticoid. And I'm sure you all know that glucocorticoids are prohibited in competition, but not out of competition. And this player in this instance was in the washout period for a glucocorticoid. But he was playing with his national team at the time. I contacted the national team doctor and informed him of the adverse analytical finding. And his response was, I don't know. He hasn't been given it with us. And then he had to contact the club doctor and find out that actually the player was given out of competition this substance. So really, really make sure that the information passes. And this is not just relevant for adverse findings, but it's also relevant for therapeutic use exemptions, or TUEs, as well. The information needs to pass when it needs to pass. And we have got a case that I'm sure some of you will recognise here. And this was not a UEFA case, but it's a case in football. And the player was tested in competition following a league match and the presence of DHEA, which is a non-specified substance that's prohibited at all times. And according to the player, he unknowingly ingested DHEA after being prescribed a supplement containing the bad substance by a medical doctor in Florida. And he received an 18-month period of ineligibility. I think the question here is, why on earth was this elite player getting supplements from a random medical doctor in Florida? It's unfortunately it's his own fault for doing it. But is there anything that you as a team doctor can do to be aware of this and try and make sure that it doesn't happen? So at this point, I will bring Zdravko back in.
Yeah, then straight at you, Zdravko. I think Becky asked the question already. Are you worried that players receive medical advice from external other sources? And how do you manage that?
Well, it doesn't really worry me because team doctors are not experts in every medical area and all the medical issues, and sometimes we must use external medical consultants. But I'm not worried since it's shared with me, and since nothing from the prescribed medications or supplements is taken before being shown to me. Because, okay, the player can have a prescription and medications, but if they show it to me, I can very easily check them if there is something prohibited, if there is nothing prohibited, or if they are from a trusted brand and look safe, I'm fine. They can use it for sure. But I believe that the answer here is to have trust between the team doctor and the players, because if they trust you, they are much more likely to share with you anything they decide to do.
Yeah, so you're quite aware of what's going on, and I hope that's the case for many team doctors. Becky also highlighted something else, that is the transfer from clubs to national teams and back and forward. How do you manage the transfer of this important medical information between those two different contexts?
Well, as Becky mentioned, it is very important to have records of everything you do, no matter medications, supplements, or whatever. So if you have that information, at first you have to share with your internal medical team or anyone in the medical team. If he decides to do something, he has to share it with you, and that to be recorded. For example, I can advise the team doctors to use share platforms or to use software. Nowadays, there are very good team softwares, medical team softwares, where you can record everything that is done, or every pill or every supplement that is taken. And that information using software can be very easily transferred to the club doctor, or from the club doctor to the national team doctor. And the relationship between club and national team doctor, there I think the communication is the key there, because if you have a good, honest, and proper communication, that will just help the players to stay clear.
Lovely. There was a comment on the chat as well, and that might be a little bit related to this. That is that a lot of players might already keep food diaries, because dietitians and sports nutritionists usually encourage this already. Is this something you see that you can use, Zdravko, to help manage a little bit what's going on and give you an insight? Do you do that?
Well, honestly, I don't do it, but it's something that I can take as a take-home message and maybe advise my players to do it in future. Because, yeah, I think a decision of the problem with the food in that. I thank you for that comment.
Yeah, there's always something new to learn. That's the mutual benefit of having a community like this. Thank you, Richard, for that comment. There is also a question in the chat, but I will go to that later, I think. Let's first go to the last little bit of our presentation. So Zdravko, again, bye-bye for a few minutes. And back to you, Becky, on education.
Thank you. I think the key message today throughout the whole session has been about education. And this is why your work and our work is so important, because education is crucial really to support the players to avoid getting into these situations where they might test positive. And really for us at UEFA and really around the world in anti-doping, we really want to make sure that the first experience that an athlete has with anti-doping is through education rather than doping control. So no athlete should ever be tested before they've actually been educated, because they need to know what the rules are and how that applies to them. So really that's something that is our mission, but we're also hoping that that can be your mission as well, that you can take away from this webinar. And if we're talking education, I guess the question is how, when, and how often should I be doing this? And I can't tell you. Every single situation is different. So I think the first thing to do would be to assess your situation. Are you a club doctor, a physiotherapist full-time with a team? Do you have a one-off mandate with a national youth team? You've really got to assess your situation and then ask yourself where you can make a difference. How you can be sure that the players receive anti-doping education before any test. So I think really it's just keeping in mind the focus and then working backwards from that and seeing how you could help on your side. How, I think the real thing that Zdravko, I'm sure, will mention is speaking to your players about anti-doping. It is one of your roles as the team doctor to support them through it. And you know your players best, whether they would learn better in group sessions, whether it's better for you to speak to them one-to-one. And players who need help or maybe require TUEs on a regular basis, these are people that you should be keeping a closer eye on as well, and receiving more education. It's also not just players. Maybe you can organise a session with other team doctors and physiotherapists within your team or your club, because it's not just important that you know this information, it's important that it disseminates throughout the club as well. And we're hoping that also you will take an active role in advocating for anti-doping education and clean sport. We at UEFA, we want to move away from the concept of catching the cheaters. Yes, if somebody does cheat, we want to catch them. But we also need to recognise that most athletes within football want to stay clean. So it's our job at UEFA and also your job as team doctors to support them to stay clean. So advise them on nutrition, advise them on safe supplementation. And it's really just supporting them with that. And I think a lot of athletes have a lot of anxiety about anti-doping. And they're nervous when they're being tested, even though they know they've done nothing wrong. And the reason they're nervous is because of the risk of accidental doping. So it's really supporting them and taking an active role in educating to make sure that they're not nervous because they know they're not going to test positive for something they haven't done. know if that made sense, but that's okay. And how often to educate? Whenever you join a new team environment, really make sure that the people within your team are aware. Don't assume that it's been done before. Make sure that you take charge and take control of the situation. Whenever new players join the squad or new members of the medical team join, really make sure that they are educated as soon as they start. And how often? As many times as you deem necessary. We recommend, if it's youth, at least every season, and then at least once every 2 years for players who've been in the game for a long period of time. But don't assume that they've been playing a long time and they know everything. The list updates every year, and it's important to keep them up to date.
Bringing Zdravko back. Thank you, Becky. Zdravko, immediately a question to you. In your role as a national team doctor, how do you educate your players?
Well, in the Bulgarian Football Union, I'm not only a team doctor of the team, but I'm also a main coordinator of the anti-doping education. So it's not very difficult for me to organize education together with the Bull NATO. However, I think that every team doctor should be somehow included and implemented in the anti-doping education, because this is the person that the players really trust. So during the group sessions, we organize anti-doping education at least once a year, sometimes more often. In these sessions, I think the most important thing is to present some hot topics that will raise the interest of the players. And after that, they can come and speak one-to-one with you. Okay, doctor, you said something very interesting during the group session, but I didn't want to raise a hand there. So I want to share this with you. And that's how you can raise trust between you and the players, and they're much more likely to ask.
And do you also educate other roles within your team and national context, other than players, like other staff?
Yeah, so anti-doping education is absolutely mandatory for the medical staff and also for the fitness coach. But during the group sessions, we also invite the head coach and other coaches or whoever wants to be there, because they lose nothing. They can learn something, and knowledge is always power. And this is how the team work.
A quick question, because before, when we talked about supplements and potential contamination, you also mentioned that your choice of where you have your restaurants or your hotels makes a difference. So you take care that you take restaurants with certain products. Is there a role to educate also, the contextual staff members who are not in the medical team or the coaching, who need to arrange for instance, those travel arrangements on certain aspects?
Yeah, as I said, all the members of the teams are invited. Usually the person who is responsible for the travel and organization of the hotel, he's somehow responsible also for the organization of the daily schedule and the meetings. So he always presents there, and he's always on the education.
Okay, so they invested. That's good to hear. Becky, what does UEFA do in terms of education on anti-doping?
We do our best. Let's go with that. So we educate the doctors. So we have the football doctor education program, and the aim really with that is to get at least one doctor from each football federation to come and be educated by UEFA, and then they go back to their home countries and disseminate the information. They cascade the information down. So we see obviously team doctors as a crucial target for our education. We also have the hat-trick program. We cannot physically within our team educate every single football player. So what we decided to do is work alongside our football federations and the national anti-doping organisations as well. And football federations can apply to UEFA for funding. And then if they submit their education plan, they explain who they're going to educate and how. Every season, they can receive funding from UEFA to do that education. And then we provide materials and handbooks and support for them to do that education. And the other thing which is coming, not coming yet, but it will be on the way, is we're going to get in the UEFA A, B Pro licenses and C licenses as well for coaches. There is going to be a topic of anti-doping within all the coaching licenses as well. They obviously don't need to know as in-depth as the team doctors, but they have such a key role in influencing the players and setting the role of the team that we see as well the coaches as a key target group for education. So it's something that for us it's grown exponentially as education in the last few years, and it's something that really we see as a key role for us to support the federations, to support the players, to do the education.
Very important work. So that's pretty obvious. Now, I know, Becky, you prepared a few summary slides that kind of summarize point by point what we aim to convey here. But there's some really interesting questions in the chat that I would like to put first, because we only have a few minutes left, but I think they're compelling to ask. So if you don't mind, we're going to skip a little summary and dig straight into a Q&A.
And for me,
first one has been waiting there for a little while already. The question is from Ketul Parmar. I hope I pronounced that right. And the question is if a player is injured during the game and has to go to the hospital, but that player is also selected for doping after the match, what is the rule in that scenario?
I can tell you the rule at UEFA, which probably is the best case I've got. So all UEFA doping control officers are medical doctors. So if a player is injured within a match, it's the doping control officer who would sign off that player going to hospital or not. So if the player has, where you say severely injured, let's say if they've got a head injury or a broken leg or something that is serious and requires immediate transfer to hospital, then it would be the doping control officer who would approve that or not approve that. Because if somebody has a sprained ankle or, I don't know, chipped tooth, something doesn't require urgent hospitalization, then they would need to stay, do the doping control first, and then they would go to hospital. But if a player was sent immediately to hospital, then there is obviously the potential that we could target that player the next day, or we could follow that up. But yeah, that's how it works at UEFA.
And if this happens, do you have a reserve player to be tested after the match?
We do. It happens very rarely, I would say, at UEFA, but it does happen. Like you see, if you watch football, there are certain times when somebody does get seriously injured and has to go. And for that, yes, we do have a reserve. We have 2 reserves and 2 targets for each team at every match that we test. That
answers the question, I guess. Another very interesting question, more based on research, this one. A lot of samples that are being collected are also being used for research, and I assume that's where this question comes from Hannah, whether athletes should give consent for research during sample collection, and what does that mean to the athlete?
It's totally up to the athlete. In terms of whether they want to give consent or not. We have Everett, who is our research expert, on the line, so I'm sure he will say, yes, everybody should give consent. What does it mean for the athletes? It means that once their sample has been analysed and it's at the lab and it is no longer needed for long-term storage, it's no longer needed for anything to do with the analysis, then the lab could anonymise the sample fully, so it's not linked to the athlete whatsoever, and use it for scientific research. So it's not just Everett who would say, do it. For me as well, it's important. The labs do so much research into anti-doping, and that's how they've got to the point where they can find 1 drop of oil in a swimming pool. So it's the use of these doping control samples. So we would encourage athletes to say yes to this. It doesn't impact them in the slightest. But obviously it's up to them. If they want to say no, that's totally fine. It doesn't affect the test. But where they are okay to say yes, please do so.
And to add to that, that is a specific question that is being asked during the doping control, whether the player consents that their sample is being used for medical or for research purposes. So Zdravko, in your experience, how many times do players consent or do not give consent? Is that 50-50, or do players are a bit more lenient to a positive answer?
As a doping control officer, I would say that it is very important how you present that information to the players, because if you just say the player, do you agree to use your urine for research? Most probably they will say no. But if you say that it is anonymous, it is after the test, it will just be used to improve the process and to discover new methods for fight against the doping, most of the times they will agree. So I believe that if you present the information in a very proper way, most of the players will agree.
Okay, that's a good addition, Zdravko, but also good for a team doctor to know that this option needs to be given, and if it's not given, then something went wrong somewhere. That's good information. And there's a final question. I think we still have time for this one. It's an important one, I think, because cannabinoid is being used more and more often. There's research going into that as well. But what do we know about its use in football, in European football mostly? Is there any research on that, Becky, that you know of?
Not as far as I'm aware. You may also have knowledge of it, but I would think on our side, minor bit of promotion, we have now got the UEFA Research Grant Programme, and there is a anti-doping pillar within the research grant programme. So we would appeal to anybody who is interested in conducting research in anti-doping European football to apply for that. You've missed this year, but there will be next year, there will be a new appeal for research going out. So please, if you are interested in doing that research, then we're very interested to hear from you.
I think that answered all the questions from the chat, from the audience. Is there any last one take-home message you would like to share, Zdravko, before we say goodbye?
Well, I would say that, just to summarize, it's very important as a staff to do our best to protect the players, because, the strict liability says that it's their responsibility, but they trust us and they rely on us, and we have to be familiar with all the specifics of anti-doping and trying to protect our players in the best possible way.
Perfect. And Becky, you have any last take-home message?
I think most doctors and most players get through their whole careers without any doping-related problems. I think that's the main message, to tell players not to worry, but also to be cautious. And it's really trying to push the message as well that they need to take responsibility for themselves and responsibility for their own careers, because and train them, I think, to advocate for themselves. So that's my main one for the players. And then for the doctors, my biggest message to you, I think, would be as well to keep records of all treatments and all medications that are given to your players. Really, really keep the best medical record you possibly can, because that really does support your player if they ever do test positive. Those are some really perfect, clear, practical messages, I think, that everybody can take at heart and take benefit of. Thank you, Becky, Zdravko. Thank you for your time. And I'm sure if more questions pop in, we will forward them to you. Thank you. Thank you. So before everybody logs off, I would like to highlight the future webinars we have planned. The next webinar is on April 28th, and we want to talk about disordered eating in football, recognize the signs and how to support player well-being. The aim of the next 3 webinars, like quarterly webinars, is to focus on a specific topic. And now with Women's Euro coming on, we thought to have a bit of a more detailed insight into women's football. So disordered eating in football happens in men's and in women's football, of course, but we're going to have a more focus on women's football for the next one.
And probably not confirmed yet, we may be having a webinar on pain medication during menstrual symptoms to avoid menstrual pain. And we also are looking to have one webinar on our upcoming ACL injury prevention and rehabilitation campaign. We know we had one before, but we think it's very important to highlight that a little bit further. So that's probably the topics of the next 3 months. But on April 28th, we're going to focus on disordered eating. And hopefully you are, again, part of our participants and audience. So thank you for your time today. And hopefully see you online in the future. Bye-bye.